Hey, everybody. Thanks for joining us for Wake Up Charlotte to Go. We have a very special guest this morning, Dr. Meg Sullivan, the medical director at Mecklenburg County Public Health. She's been with the health department since 2018, previously worked in the New York City Department of Health and Mental Hygiene. She went to Yale for undergrad. I just feel like I have to read your bio because it's so impressive. Got her MD at UC San Diego, has her master's in public health from Johns Hopkins. So thank you so much for joining us this morning.
Of course. Thank you for having me.
So first, let's just talk about booster shots. Of course, right now, a lot of people have been asking us questions about mixing brands specifically.
Yeah, so I think, the first thing that I always want to say is every opportunity we have to talk about vaccine is the most important thing that anybody can do is to get vaccinated with what we refer to as the primary series, or those initial doses of the vaccine. We still have way too many people here in Mecklenburg County who are not yet vaccinated, who are eligible to do so. And especially with the holidays upcoming, this is the time to get vaccinated. When we look at what is happening with our numbers, with our hospitals, with our deaths, it is still predominantly in individuals who are not vaccinated. But also a recognition that for those individuals who are vaccinated, the vaccines are doing their job and they are really significantly reducing the risk of people testing positive or getting severely ill or having to go to the hospital from COVID. But there is also a recognition that some of that level of protection is starting to wane. And so some recommendations are coming out around booster shots. What we know right now is that for individuals who receive Pfizer as the first 2 doses of their vaccine are now eligible to receive a booster dose at least 6 months after their second dose if they fall into a higher risk category, which includes age over 65 or individuals 18 to 64 with high risk medical conditions or who live or work in a high risk setting. What we also know is that the FDA has been talking at great length about recommendations of booster doses for both Moderna and Johnson & Johnson. And there were some recommendations that came out last week from the Scientific Advisory Committee that talked about those recommendations. And we expect some information to be coming out today and tomorrow with the CDC Advisory Committee on Immunization Practices are going to be meeting. And then to get to your question about mixing and matching, currently the recommendations really are geared towards individuals receiving that same dose of the vaccine as a booster dose as the initial series. But there is some data that is coming out that does look at both the safety and the effectiveness of that mixing and matching. At this point, there are no official recommendations and no authorizations to administer a vaccine that is different from what someone received from the primary series. But we are expecting information from the FDA to be coming out potentially today, but definitely in the coming days about that. And we're obviously going to be watching that closely.
Doctor, by the way, let me say for folks watching this, if you have any specific questions for Dr. Meg Sullivan with the Mecklenburg County Public Health Department, let us know. You can include those and we'll try to get to them. But you said something that I thought was really interesting, and that was before we even get to the boosters, we still have a sizable population here in Charlotte, here in Mecklenburg County, that still have not gotten their initial vaccinations for this. At this point in the game, a year and a half into this pandemic, 8 or 9 months into mass vaccinations, it's widely available. People at your workplace have done a tremendous job trying to get it out to as many people as possible. For a lack of a better phrase, what gives? What else needs to happen before we're going to see some of those last holdouts get vaccinated?
Yeah, I think it is obviously a question that we have been grappling with. And as you mentioned, we've been working incredibly hard with all of our vaccine providers and community-based organizations to really assure the vaccine is widely available. It's available at no cost. There are no barriers to receiving it. There's no specific identification or insurance that you need to bring. And we really want people to make sure of that. But we also recognize that there still are individuals who have different questions, concerns, or reservations about receiving the vaccine. And we have been working as hard as we can to try and address some of those. And I think what I would ask individuals who have not yet been vaccinated to make sure that they are getting accurate information about the vaccine. It has been unbelievable how much inaccurate or misinformation there has been available about the vaccine, about the safety, about some of the side effects. And it's really important to get that accurate information. And that is something, again, that we value and really encourage people to reach out to the health department, to reach out to their primary care provider or their doctor, to reach out to to someone they trust and really have that conversation. But I think second is really to look at what is happening right now. And again, if you look at people who are in the hospital right now, if you look at people who unfortunately still are dying every day from COVID, it is largely people who are not vaccinated. And the data is just overwhelming that the vaccine is safe and it's preventing deaths. And the more people we get vaccinated, the better we protect our community.
We've heard from, some people that have gotten the Johnson & Johnson shot. It was one shot. So they've been concerned about, do they go ahead and get a booster shot, a different brand, to try to get that second dose and protect themselves? What do you think about that?
Yeah, I think it's a really good question. Again, the Scientific Advisory Committee reviewed data that was submitted by Johnson & Johnson last week that requested authorization for a second dose at least 2 months after individuals had received that first dose, and they unanimously voted to recommend it. Again, the steps that need to happen for that to be available is the FDA still has to issue emergency use authorization in order to be able to administer that vaccine, which again is expected to occur likely sometime this week. And then today and tomorrow, the CDC Advisory Committee on Immunization Practices is going to meet to review that data and determine any clinical recommendations. So we expect lots of information to be coming out this week. This question, though, so that's related to someone who got Johnson & Johnson receiving another dose of the Johnson & Johnson vaccine. The question about mixing and matching, as I said, I think there's been a lot of conversations, a lot of information coming about it, but we don't have any formal recommendations yet. So what I would say to individuals who are asking that question, first, it's great that they're asking that, right, and looking at the information, and to really expect over the coming days some more specific recommendations and information to come out. And again, if they have questions about it, to talk to the health department, to talk to their doctor, because we always want people to feel comfortable with vaccines that they're getting.
We are getting some questions right now, Doc, from folks watching this right now. There's a number of ones, but the most recent one I think is actually fairly helpful for a lot of people. Kathy Cole saying one of my friend's doctors told him because he got the Moderna shot that he did not need to get the booster. He said the Moderna shot was the best out there. Is there some truth to that? I know we reported here on Wake Up Charlotte probably a month or so ago that it seemed like the efficacy of the Moderna shot was at least lasting longer than the Pfizer shot. Any truth to this?
Yeah, so I think first, obviously, it's important to recognize that all three of the vaccines are incredibly safe and effective and have really done a remarkable job at preventing the risk of getting sick and especially severe complications from the vaccine. But there is data that has come out recently that does suggest that the efficacy of Moderna, and in particular, kind of the length of time that it is able to have a higher level of protection of preventing people from being hospitalized, is higher than either the Pfizer vaccine or the Johnson & Johnson vaccine. So I think that has been very promising data, but specifically about individuals who got Moderna shot and whether or not they should get a booster dose, to recognize, though, that there is still some data to suggest that level of protection does still decrease. Again, maybe not as much as some of the other vaccines. And so particularly for individuals who are at high risk, again, over the age of 65, or have underlying chronic medical conditions, or in a role that may put them at higher risk of exposure, those are conversations that, again, this FDA Advisory Committee recommended that at least a vaccine or a booster dose be authorized or available for those individuals. We expect CDC to be weighing in on that over the next couple of days, and then really encourage individuals who did get Moderna, who, especially if they may fall into one of those higher risk activities, to have a conversation with their doctor about whether a booster dose is right for them.
Well, we just talked this morning about the potential for a fourth dose for immunocompromised people. Do you see this being something like a flu vaccine, where we are going to have to get it once a year or twice a year to stay protected?
Yeah, I think that's a great question. And I think, the honest answer is that we still don't know exactly what vaccines or the COVID vaccine is going to look like over the coming years. I think a lot of that depends on the level of vaccination that we can achieve right now. I think the more people that we can get vaccinated, the less the virus is able to spread and mutate. So the less likelihood that more contagious variants spread, like we've been seeing, or that the virus persists in high levels. So again, another reason why we've been working so hard to get as many people in our community vaccinated as possible. But I think we also recognize that COVID is here to stay, at least in some format, and that there likely will be a need to continue to take preventive measures, which likely includes vaccination in the future. What that looks like, if it is a annual vaccine, if it is every few years, if it is, every 6 months, that we just don't know yet. But again, a lot of it depends on the factors. And the most important thing we can do right now is to get people to get those initial doses of the vaccine to prevent so much virus spreading in our community.
I do want to get to one other question that somebody asked, because I think it sort of appeals to a broader issue, and that is Doris mentioned that she's vaccinated, but she's not sure about the booster because she said she had a friend that got it and then died that night. For one, Doris, that our sincere apologies about your loss of a friend, but broader picture, I do understand that something like this happens to somebody that's going to scare you, and understandably so. But help us understand the difference between an anecdotal situation like this, that something happens and I don't know what happened here, or I'm sure you don't know either, but something anecdotal versus broad picture when it comes to these boosters and these vaccines.
Yeah, I think it is a really important question. And again, I think I will echo my condolences and obviously don't know the details of that situation. But what I do know is that safety for vaccines is really always been a top priority. And that has certainly been the case for the COVID vaccines. So I think we all know the rigorous process that they had to go through to be authorized, and that not a single step was missed before. And this included over 100,000 participants across the 3 vaccines from diverse backgrounds in the clinical trials. And all of that had to occur before that authorization even occurred. But even afterwards, there is a robust system in place to do safety monitoring of vaccines. And every single adverse event that is potentially associated with a vaccine is required to be reported, and those are analyzed in detail. And I think we saw kind of early on, it allowed the CDC to recognize, out of 1 million doses, 6 or 7 adverse events that had happened to, result in a pause, a very thorough investigation and review, because again, safety is the top priority, and they wouldn't move forward until they were confident that the benefits far outweigh the risks. So I think it's the same thing when it comes to in cases like this, that this will be reported, it will be investigated. Again, a recognition, though, that overwhelmingly there is data that shows that the vaccines are safe, that they're saving lives, and that individuals should be getting them.
Dr. Meg Sullivan, thank you so much for joining us this morning on Wake Up Charlotte and taking our viewer questions. We really appreciate it and all the work that you're doing.
Thank you.
Take care.
Bye.